Hello, and welcome to the American Massage, Chiropractic, and Acupuncture Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in San Diego, California, April 20th through 22nd, 2012, and who are brought to you by One Concept. I'd like to take this opportunity to thank the 2012 American Massage, Chiropractic, and Acupuncture Conference sponsors, Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, and Massage Envy Careers for making this year's event possible. Our special guest today is Dr. Andreo Spina. Dr. Spina and I will be talking about his 3-hour class, Functional Range Release. But first, let me tell you a little about Dr. Spina. Dr. Andreo Spina holds a Bachelor of Kinesiology degree from McMaster University. He later graduated with summa cum laude and clinic honors from the Canadian Memorial Chiropractic College as a Doctor of Chiropractic and subsequently completed the 2-year postgraduate fellowship in sports sciences. In addition to being both the creator and head instructor of functional anatomic palpation systems and functional range release techniques, Dr. Spina has also authored chapters in various sports medicine textbooks, is a published researcher, and an international speaker on the topics of fascia, soft tissue assessment and treatment, flexibility training, and physical conditioning. Dr. Spina, welcome to the American Massage, Chiropractic, and Acupuncture Conference pre-conference broadcast series. I'm so appreciative of you making time to talk with me about this event and about your class on functional range release.
Well, I'm very happy to be here and am very much looking forward to the event.
Well, we're very pleased that you've decided to join us in San Diego, and I do want to hear about your topic, of course, and hear what the class is going to be about. But before we get into that, I'd really be curious to know, what are you most looking forward to seeing or doing at this year's event in San Diego?
Well, first of all, I'm looking forward to seeing San Diego because I haven't been there yet. But more importantly, I enjoy any opportunity where I can kind of mingle with various healthcare professionals, especially at this particular conference where there'll be chiropractors, massage therapists, acupuncturists, and so on. So anytime I can meet with colleagues and in this type of forum, I really enjoy it. And other than that, the speakers, from what I can see on that are presenting this year, are excellent. So I would love to take in a few of the speakers myself.
No kidding. I'm really hoping that I have a chance to get to a lot of the classes myself, although it can be challenging when you're teaching to do that. Now, Andreo, a lot of the presenters that I've spoken with in this interview series have mentioned just how excited they are to see the expansion of this year's conference to include chiropractic and acupuncture in addition to massage therapy, and you were just kind of mentioning that too. Why do you think that the uniting of these disciplines is important?
I personally like to take a stance that all manual medical practitioners kind of have, the ability to do what all other manual medical practitioners can do. It's kind of an open career, or it's kind of an open. I don't know what I'm trying to say here, but with my seminars, for example, I like to teach various different types of therapists. Physiotherapists, massage therapists, chiropractors, acupuncturists, because I think we all do the same job, and that's, try to get people better. And anytime you have an opportunity to speak with people of various disciplines, you find very quickly that they can offer you a lot that you may not have thought of in your particular type of approach. So I think it's great to incorporate everyone and kind of just think of all manual practitioners on one playing field.
Well, I couldn't agree with you more, and I know I always learn something new, a new approach, a new way of seeing things, maybe even just a new technique I didn't know was out there when I learn from others, in the healing arts, be it acupuncture or maybe even someone that does herbology or something. Just the way that they look at things really helps me to improve what I do.
Absolutely.
So let's talk about your class. There are so many techniques and seminars out there now that are available to practitioners. I'm guessing that perhaps you felt something was missing from those techniques and that's what prompted you to develop yours. Can you tell me a little bit about your thoughts there?
I thought there were a few things missing. The first thing was the lack of detailed palpatory training that we received during our educational process. Whether you're a massage therapist or a chiropractor or a physiotherapist, for example, all of the curriculums kind of take a 2D model with approach to learning anatomy. We learn the origins, the insertions. We visualize these origins and insertions on two-dimensional textbooks. And then in some cases, if you're lucky enough to go into the anatomy lab, that provides a great opportunity to see real anatomy, but it's really not the way that we see anatomy in our patients. We have to learn to see with our hands, so to speak, in palpating real three-dimensional beings. So the first part that I thought was missing, and the first seminar series that I put out was the functional anatomic palpation systems, which really is a system of how to systematically locate and assess anatomical tissues. Following that, I really thought that after the assessments are done, the treatment techniques that are out there, for the most part, what happened was techniques were developed and then they kind of retrospectively went into the research to try to figure out if there's any evidence basis for what they were doing. I wanted to try to take the most current research and create a system out of the current research so that we can better affect the tissues that we were trying to treat.
Excellent. So, I hadn't really thought about that much until recently. A number of therapists have been talking about research-based, evidence-based treatment. And I guess that's true, particularly in massage therapy, where for so many years there wasn't really research at all. And a lot of the techniques I'm sure that I learned and perhaps even still use, they came from, an intuitive basis, or perhaps they had been done in some other way and someone tweaked them because it happened to work for their client, but they weren't basing it on research. They were just basing it on perhaps personal experience or intuition. Which
is a great way to do it. I mean, that's how things are created and developed. But at this point, there's so much research out there on soft tissue mechanics that what I wanted to do is kind of hone the techniques that are being utilized and then add things as the research would allow.
Well, that makes perfect sense. And I think that's a really interesting way to do it. It's really where you would think it would start, the research first and then the technique, but in a sense, compared to some of the things that are out there, you've flipped it around and put the horse in the cart in a different position.
Mm-hmm. Yeah.
So now, Andreo, as I understand it, as you were saying, the seminar series is divided into the two components. Can you explain why it's set up that way?
Sure. The first component, like I said, is the functional anatomic palpation systems, or FAP. Those seminar series, there's three to that series. There's one for the upper limb, one for the lower limb, and one for the spine. In that particular system, I wanted to create a basis of assessment techniques and palpatory knowledge for the practitioner. So in other words, I wanted to systematically show the practitioners how to localize tissues, and then once they're localized, decide whether or not the tissues are pathologic or not, or whether or not they need treatment or not. So the FAP system really takes care of the first part of the treatment interaction, where the patient comes in, you've taken a clinical history, and now it's time to go ahead and assess tissues. What I noticed in my clinical practice and going through school is that there's a real high reliance on orthopedic testing, and if anybody's actually gone into the research on orthopedic testing, you realize that it's very nonspecific and it's not very sensitive. And there's a good reason for that, and it's because orthopedic tests are developed to tease out or to assess macroscopic tissue injury. By macroscopic, I mean overt tears of ligaments or ruptures of muscles, etc. Realistically, as manual practitioners, we're not dealing with macro tissue injury. We're dealing with micro tissue injury for example, fibrosis, scar tissue, tight muscles, etc. So I thought there was a real disconnect between the educational system and what we actually do in clinical practice. And really the thing that separates good manual therapists from average manual therapists is the specificity of their palpation. So I wanted the FAP system to enhance the specificity of what manual therapists were doing. I want them to be able to put their hands on a particular structure, know exactly what the structure is, and then be able to assess it, more accurately. Now that might seem, to some people, it might seem that intuitive. It might seem like they've learned anatomy, they know how to palpate, and that's really the kind of the attitude that people have coming into the FAP system or coming into the seminars. They say, "Oh, this is kind of going to be a review for me." And then the most common thing I hear when they're leaving the FAP seminar at the end of the weekend is, "Wow, I really learned that perhaps what I thought I was touching or what I thought I was assessing really wasn't what I was actually touching or assessing."
I gotcha. So just to make sure I have this I understand this and that our listeners understand, because we do have a lot of students that are listening in and that will be at the conference. Orthopedic testing, as it were, is more general and is looking at those larger injuries that are perhaps beyond what a manual therapist is likely to be treating, whereas the type of assessment that you're teaching in your bigger workshops is more specific and accurate to look at these smaller injuries that manual therapists are likely to address and encounter on a regular basis. Is that correct?
Somewhat. I'll give you an example which will really drive the point home. If someone, for example, if you go to your medical doctor and you have shoulder pain, if you have a really good medical doctor, they might decipher from orthopedic testing that you have, let's say, an impingement problem of the shoulder. So then they'll refer to the manual therapist, and we get that little referral slip that says, impingement syndrome, treats with, whatever they say, ultrasound and soft tissue. That's great as a medical diagnosis, but for the manual therapist, impingement syndrome can mean so many things. It can mean, a subacromial bursitis, a supraspinatus tendinosis, a supraspinatus tendinitis, an internal impingement or a posterior glenohumeral joint impingement. It could be a subscapular bursitis. It could be so many different things, biceps tenosynovitis, biceps tendinosis. All of these specific diagnoses require very specific approaches in order to correct the histology or the pathology that is involved. We really can't tease out the specificity of the problem with orthopedic tests. It kind of only points you in the general direction. But for a manual therapist, our diagnosis has to be more specific in order that we can choose the appropriate tools to combat the pathology. And how do we get more specific? We get more specific with our ability to palpate tissue and to distinguish between normal and abnormal structure. So that's really the purpose of the FAP system.
I gotcha. That makes sense. And certainly, assessment has been something I've talked about with a number of the educators that are going to be at the conference, and it is really important to, especially if you're a pain relief therapist, and really treating that as opposed to just general relaxation, to really be educated about what you're working on and using the treatments that are going to be the most effective.
Yes, exactly. That's the main purpose of the FAP component.
Wonderful. So now we've talked about the functional anatomic palpation system. The second component of the treatment system is functional range release technique, which is what you're going to be talking about at the conference. What is it and how is it different from other techniques?
The functional range release system, once again, like I said before, I wanted to take the research, I wanted to take the most current understanding of soft tissues and apply those concepts to the development of a system of treatment. The first thing that sets FAP apart is really the target tissue. For the most part, manual therapists have been very muscle-focused. We think of things like tight hamstring muscles or tight lower back muscles, and we always have that kind of muscular focus involved. Now I'm treating the quadratus lumborum, now I'm treating the biceps femoris, etc. But when you really think about it, muscular structure is really composed of muscle proteins, actin and myosin, etc., and the innervating motor neurons that go to them. it's never really been the job of a manual therapist to pull apart actin and myosin bonds. That's very easy. It's as easy as just extending the limb to lengthen the muscle. And it's never been the goal to, rip out the innervating motor neuron, obviously. So what has been the goal? In my view, the goal has really been to deal with abnormal deposition of fibrosis. Now, where does fibrosis develop? Fibrosis develops not within the muscle cell itself, but in the binding components of the muscle, or the fascia. So the number one thing that sets apart the FR system is that our target is the fascial components of the muscle. Another problem is a lot of therapists really, when you say the word fascia, they think of only the tissue surrounding muscle. But in reality, it's not only the surrounding tissue of the muscle, but it's the tissue surrounding the bundles of the muscle, the paramecium, the individual muscle cells, the endomecium, as well as the entire muscle, which is the epimecium. So really the system focuses on removing scar tissue and fibrosis on all different levels of fascia, starting with the fascia superficialis, or the fascia located underneath the skin, separating that from the underlying fascia profunda, which is the epimecium, paramecium, endomecium. So that's the first thing, which is, it's the target is different with the FR system. A lot of people might be thinking to themselves, what's the difference? I was treating tissue. If I said I was treating a muscle, I was actually treating the fascia. Who cares? It's important to care because it's not a matter of simple nomenclature, and that's because the research demonstrates that fascia does not respond in the same way that muscular tissue does. It responds very differently, in fact, to the loads that are imparted upon it. For example, in order to create fascial change, the loads imparted have to be held for longer periods of time. The other things are, instead of just thinking about muscles moving, we have to think about fascial planes sliding over each other. And those are just a few of the things that are really focused upon in the functional range release system.
Well, I tell you, every time I talk with you, I'm taking notes furiously and thinking, I don't even know if I can keep up with this information because, it's a little bit beyond what I do. I'm a basic, I would say, an old school relaxation-based therapist that incorporated a lot of pain relief into what I do, but my knowledge on fascia is not as strong. But I think what I've really learned as a therapist is exactly what you were saying, is that the fascia, if you really want to be effective with the fascia, you have to treat it differently than muscle. And that's, something I think people are hungry for. I certainly know that I need to learn more about it. And I think that this class sounds like an amazing way to help that, to really improve the knowledge base of a therapist like me who doesn't have as much training in that area as in other techniques.
I hope so. I hope to kind of give an overview of the research that is available on this, amazing tissue, and then give ideas as to how you can alter your treatment procedures in order to cause greater effects on the fascial tissue. There's other reasons why the FR system is different as well. The other thing that we look at is going back to the muscle. When people are injured or people are in pain, we have this problem of post-injury muscular contraction or spasming, or increased neural drive to muscular tissue. And this is problematic because if our goal is to treat the fascia, if the muscle is hypertonic, well, then it's going to restrict the particular range of motion across an articulation. So the FAP system also has another technique called PALS, or progressive angular isometric loading, which we use in order to decrease what we call the neuromuscular barrier, or decrease the neural drive to the muscle, relax the muscle so that we can achieve a greater range of motion momentarily, and therefore allow the practitioner to get a better fascial release. So that's the PALS system is another kind of area that we discuss, which is incorporated with the treatment, and then it later on helps with the rehabilitation process as well, actually.
So, I was just doing an interview with Angie Dubas, who is doing a class on the fascial matrix related to forward head postures. And one of the things that she mentioned in that interview was about using movement to release the fascia, in particular like range of motion or rotation.
Mm-hmm.
So is that kind of what you're saying, that when you're talking about improving the range of motion of a muscle to get into the fascia, is that similar in what you're talking about, or is it a different approach?
It's a little bit different what I'm talking about. I'd like to speak to what that particular presenter is saying, but what I was referring to more is the fact that when the human body experiences pain, automatically it's going to increase the neural drive to the muscular tissues surrounding the area of pain. Therefore, when we think of going to release some soft tissue, we're only releasing it to the extent or to the range of motion allowed by the nervous system. So there are little ways that you can trick the nervous system to allow greater ranges of motion so that we can better access the target tissue, which is the fascia. And I think it's really interesting what you just mentioned with that particular presenter, because that's something that I focus on a lot as well. The fact that what our goal is really to treat fascial planes and to allow fascial planes to slide on top of one another. Mm-hmm. I discussed the fact that movement is almost a necessity when you're trying to treat fascia. And there's various reasons for that that I discussed at the seminar, not the least of which is that fascia responds best to the application of tension as opposed to compression. So if you're simply kind of putting a lubricant on a patient, pushing down on them and sliding over the skin, that really doesn't alter the relative motion of the various fascial tissue planes. In order to alter those motions, movement, as that other presenter was discussing, is absolutely necessary so that we can pull apart the fibrosis by creating that relative motion between layers.
Wow. I really learned so much through these. That's fascinating. I would love to be involved or just to listen in on the discussion that the two of you have on this, because it sounds like you've got some, between the two of you, some great techniques and ideas that can really help therapists learn about how to address fascia. And I certainly hope I'm one of them, because I definitely want to increase my knowledge in this area.
Well, now that you said that, I'm definitely going to be attending that presentation if it's not at the same time as mine.
Right. Well, I know she'd love to. I think you should both attend each other's if you can. I think you'd both get a lot out of it and be good sounding boards for one another, or, good extra resource in the classroom. Now, your website describes the functional anatomy seminars as including training in tissue assessment, treatment, rehabilitation, and conditioning. We've talked about a couple of those, in particular the tissue assessment and the treatment. So how do you incorporate and present all of these components?
Yeah, how it's broken down is this. Like I said, you have the FAP upper limb, lower limb spine seminars. They really deal with the tissue assessment components, so the teaching how to localize specific anatomical structures, and then going ahead to assess those structures. The treatment component comes out in the FR seminars, which, once again, there's an upper limb, lower limb, and a spine. There's a prerequisite to attending the FR seminars, which is the corresponding FAP. So if you've done FAP lower limb, you've learned the assessment techniques for the lower limb, then you can attend the the FR lower limb, which takes you into the treatment. Getting back to what I was talking about with the PALS, the progressive angular isometric loading, that particular technique, which is part of the FR system, is used to, like I was speaking to before, temporarily improve range of motion so that we can further release fascial tissue. But not only does it temporarily increase range of motion, as does, let's say, PNF stretching or PIR stretching, but we go a few steps further in that we try to strengthen the newly acquired range. Now, why do we do that? We do that because the human body works in such a way that you're only as flexible as your nervous system allows you to be. And why does your nervous system govern flexibility? One of the major reasons why it governs flexibility is it will only give you a range of motion that you can control. For example, if you go and put your one leg up on a table at 90 degrees and then take the leg down and put another leg up on a table at 90 degrees, you've really so now you've created 90 degrees on both sides. Just because you can do that, it doesn't mean that you can go ahead then and do them at the same time or perform the splits. one of the reasons you can't do the splits is not because the range of motion isn't there. It obviously is. You did 90 degrees on one side, 90 degrees on the other. One of the major reasons you can't do the splits is because you've never taught your body how to control that range of motion, because there's no strength in that range of motion, so your body will not allow you to do it. So with the PALE system, as we're expanding the range of motion for treatment, we're also working on building strength and endurance in the newly acquired ranges. And by doing that, your body will then begin to incorporate those ranges of motion into its functional movement patterns. So that's really the rehabilitative portion of the system. Getting that kind of starts to parlay into the conditioning system, and there's another set of seminars that I'm putting out relatively shortly called Functional Range Conditioning. Functional Range Conditioning will then expand on the rehabilitative and conditioning side, where we're going to show people how they can improve and increase their own functional mobility and flexibility. So as a whole, the system really, the entire system really takes the person through the assessment principles, the treatment principles, parlaying into the rehabilitation during treatment, as well as in the exercises you prescribe to your patient, and then the conditioning system, which is coming out slowly, which would be teaching practitioners how to teach patients how to improve their range of motion, their flexibility, and their mobility.
Now, when you talk about conditioning, I mean, my mind automatically goes to athletes. But what kind of patients or clients are you likely to treat with this, or who can benefit from this system?
I really haven't found a particular subset of patients that wouldn't benefit from it. Of course, I'm a sports specialist, so I always have athletes in mind. But I really take the approach that, you know, everyone should be treated like an athlete in some respects. I think with athletes, we tend to try to be more specific, and we try to get more into the rehabilitation and conditioning. But for me personally, I believe that the end goal of all manual therapists should be to improve the functional mobility of the patient. So their ability to move freely and to move dynamically in pain-free ranges of motion. People get that confused with flexibility, which I tend to disagree with. I don't think that it should be a goal to simply be flexible, because just because you're flexible when you're stretching, it doesn't mean that you can control those ranges. I think it's more important to make the patient mobile. And what is mobility? Mobility equals strength plus flexibility. So in the system, we really emphasize building strength in the flexible ranges of motion, so that that person has the ability to move better, to move more fluidly, to move with better biomechanics, with less muscle imbalance, etc. So it improves their functionality in everyday life. It decreases the chance or likelihood of pain in the future by correcting biomechanics and keeping the person strong and flexible simultaneously.
Wow, you know, it kind of reminds me of what you're saying, of what the way I explain yoga to some of my clients. When they talk about, you know, I need better flexibility, I'm like, well, it's not just about flexibility, it's about strength and length. And so you want to support the muscles that you're lengthening by making sure they're strong, and that the surrounding muscles are also strong. It's more about having a balance. So in a sense, it kind of sounds like you're talking about hands-on yoga almost, to create that mobility. I really like the strength and the flexibility combined, and not just having this wild ability to put your foot behind your head.
Yeah, well, I mean, I would refer to that as useless flexibility. It's you see it all the time in athletes. They do a lot of stretching, and it doesn't really alter the way they play their sport. I mean, unless you can add strength into those ranges, you will not get mobility. And if you don't have mobility, that cannot translate into agility, which is what should be a main focus in most athletes, is getting more agile. If you can't really utilize those ranges of motion, they're pretty much only useful, like you said, in yoga class when you're stretching, not when you're trying to catch a football, or if you're a martial arts fighter and you're trying to kick someone in the head. If you don't have control over those ranges, they're not available to you. You have to teach the nervous system how to use them.
Right. That makes perfect sense. I'm more intrigued by everything you say.
Well, that's good news.
So Dr. Spina, in the class in San Diego, is there anything specific that your attendees and students will get, or anything that they should be expecting to get?
Yeah, what I'm going to do is I'm going to give an introduction lecture for both the FAP and the FR systems, and in those lectures I'm going to review the scientific principles that were utilized in the making of those systems. And then I'm going to take the participants, I believe I'm going to be doing the medial thigh region. I'll take them through and I'll demonstrate how the FAP system is utilized to be very specific with the soft tissue palpation. And then we will actually be going over a few general FR protocols in the same region so that people get a real feel for what we're doing. Even if you're not interested in the technique particularly, I would wager a guess that you will be after the end of the seminar. But even if you really wanted to hear some discussion about the current fascial research, that'll be, I'll be focusing quite a bit on that, as well as this concept of improving functional mobility. So I think, there's a lot of things that the practitioner will come away with. Many of those things will probably help or change the way they see their patients Monday morning, and that's really the goal of what I want to do. I want to get people thinking about some things and get people thinking about being more specific with their assessments, more specific with their treatments, and ultimately that will lead to more specific results with their patients.
I have no doubt about that. And boy, this has just been such an intriguing conversation. And even though we've talked about it before, I feel like I learned so much more about what it is exactly that you do. Maybe it's just me wrapping my head around it a little bit more than the last time we discussed it, but it just sounds fascinating. I really hope that I can at least sneak a peek in your classroom and catch a few minutes of this material, because it seems so, I don't know, it makes so much sense to me as you're talking about it.
Yeah, I mean, I'd love to have you there. I think I try to keep the seminars or the conferences or whenever I'm speaking, I try to keep them dynamic. I love the conversations. I love the questions. I love discussing other people's ideas. So it's really the presentation will really be an open forum, so to speak, and we'll try to discuss various concepts and my take on things, and just try to make it really a good learning experience for everyone there, including myself.
Well, I'm sure that it will be. There's some people that are not going to want to wait until San Diego. They're going to want to go ahead and, learn more about this type of thing, or, maybe they're already doing it, working with fascia or the functional mobility. Any suggestions that you have on how they can improve that type of work, or one tip that they can use right now to help their patients?
I think my major goal has always been thinking specific instead of thinking in terms of broad-based assessment, broad-based tissue contacts, broad-based prescription of exercises. I think that from my experience, the more specifically you can define a problem, the better or the more able you will be to select the tools which will correct that problem. So I think the one main word in my mind is always specificity. Specificity is the key to specific results.
Great advice. And for those that aren't able to make it to San Diego but want to take some of your classes in other locations, can you tell everybody how to get in touch with you, where they can learn more about what you do and the other programs that you offer?
Absolutely. The website is functionalanatomyseminars.com. That kind of gives an overview as to what it is that we do, as well as the list of our instructors, all of their biographies, etc. And you can register for seminars online. We're currently doing seminars in Canada and in some areas in Europe. Italy, I think we'll be in the Netherlands in September. So that's for the seminar information. I also have a blog which I update quite regularly called it's functionalanatomyblog.com. On that blog site, you'll find various posts on a lot of the topics that I've been presenting or that I've been discussing with you. For example, the assessment of and the importance of fascial planes, the application of PALS, progressive angular isometric loading, etc. So functionalanatomyblog.com, and then I also have a Facebook fan page, Functional Anatomy Seminars, that you can look up and become part of. I like to be really interactive with the people who have taken my seminars or who are interested in my seminars. So I advise you check that out as well. I put up various articles that I've read, et cetera, on the Facebook page as well.
Well, I think there's a lot of great places to connect with you, and I definitely suggest that people check out the website and your blog if you want to read more about the classes that Dr. Spina has and the resources that you've mentioned. So thank you for sharing that. Right now, what I'd like to do is make sure everyone knows how to sign up for your class. So let me pause for a moment here and talk about just how people can get involved in the conference. The American Massage, Chiropractic, and Acupuncture Conference is one of the largest exhibitions of massage, chiropractic, and acupuncture products, continuing education, and business opportunities for practitioners of all three disciplines. This year's conference will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1-day workshops, including Dr. Spina's. Other events during the weekend include a free keynote presentation sponsored by ABMP with Dean Juhan, the author of Job's Body, a charity golf tournament benefiting the Make-A-Wish Foundation, and the One Concept Gala and Dinner Dance. The registration cost for the conference is just $40, which includes admission to the trade halls and all 1-hour presentations, participation in raffles, and giveaways of literally thousands of dollars in prizes. Also, there will be between-class coffee breaks and loaded goodie bags for attendees. Everyone attending will also have access to many special offers and promotions from the conference exhibitors, as well as the chance to have a fantastic time with friends and colleagues. Now, for students, the conference also offers a free student day and Smart from the Start program on Friday, which is sponsored by Massage Warehouse Script and Performance Health. This day is dedicated to massage, chiropractic, and acupuncture students who are currently enrolled in school or who will graduate in 2012 and includes a free gift bag for the first 350 people. Also on Friday, all attendees are invited to attend a special presentation, Disciplines Unite, from 12 until 2, and the One Concept Job Fair from 2 until 4. All of this is happening at the Conference Hotel. That's the Town & Country Resort and Conference Center, and I definitely suggest you make plans to stay there if possible. Single or double rates are just $125 a night, but space is limited, so please make your reservations now. Also, MPA Media is printing the American Massage, Chiropractic, and Acupuncture Conference event program inside all three of their magazines, Massage Today, Acupuncture Today, and Dynamic Chiropractic. These will be given out at the conference and distributed throughout the U.S. to over 133,000 practitioners. So if you are a vendor or an educator who's listening in today and you'd like to get some great exposure for your class or product, please contact Sandy Pierce of MPA Media for details on being a part of the conference program. So if you're ready to register for the 2012 American Massage, Chiropractic, and Acupuncture Conference in San Diego, and of course to meet Dr. Spina, myself, and the other amazing instructors, there are now 2 ways to do so. First, you can register and take your courses online instantly on the official conference website at AmericanMassageConference.com, AmericanAcupunctureConference.com, or AmericanChiropracticConference.com, depending on your discipline. You can also register by phone. The call is free, and operators are waiting to speak with you at 877-674-3504. That's 877-674-3504. We also invite you to stay connected with us on Facebook at facebook.com/American Massage Conference, /American Chiropractic Conference, and /American Acupuncture Conference. Again, the 2012 American Massage, Chiropractic, and Acupuncture Conference is made possible by all of our wonderful sponsors. Thank you so much to Massage Warehouse Script, MPA Media, H.J. Ross, ABMP, and Massage Envy careers. I'm sure after today's broadcast, everyone listening is ready to come to the conference and, of course, to register for the 3-hour class on functional range release with Dr. Andreo Spina. Andreo, thank you again for taking the time to be with me today and for choosing to be a part of the 2012 American Massage, Chiropractic, and Acupuncture Conference. We're honored to have you there this year.
Oh, thank you so much. I'd like to take the time to thank the One Concept group myself for sponsoring me to come out there. I'm really looking forward to it, and I hope to meet a lot of other practitioners at the seminar.
Well, I'm sure they'll be looking forward to meeting you as well. This is Felicia Brown, and on behalf of everyone from the American Massage, Chiropractic, and Acupuncture Conference and One Concept Radio, I want to thank you for tuning into this edition of the pre-conference broadcast series. Please remember to tune in each week through April 16th for more interviews and to visit our websites and Facebook pages for replays of all the interviews in this series. We look forward to seeing you in San Diego in April. Please also consider joining us for the Canadian Massage and Chiropractic Conference this fall in beautiful Niagara Falls. That's October 12th through 14th, 2012. Thanks again for tuning in, and have a fabulous day.